Welcome to Tiny Talks in Physiology. Today let's discuss a case scenario which was first question or long essay in January 2024 Physiology paper 1. A 2-year-old baby girl was admitted presenting with pallor, recurrent fever episode, weakness and fatigue since 4 months. On examination, there is splenomegaly, normocytic, normochromic RBCs in the blood picture, but there are significant number of blast cells. Then coming to the blood test, there is thrombocytopenia. So these are the information that we have got. Now from this, we have to, the first question is, what is the diagnosis? Definitely it is acute leukemia. Reasons are the symptoms. There is pallor, fever, weakness and fatigue. Now it is very acute, just 4 months. So it is acute in nature. There is splenomegaly, and also there is a significant number of blast cells in the blood picture. So these points help us to come to a diagnosis as acute leukemia. Okay. Second question is, what is the significance of seeing the blast cells in the peripheral blood smear? So blast cell are actually an immature precursors of WBC. Normally it is not seen in the circulation as it will be present inside the bone marrow. But in case of acute leukemia, there is mutation of this precursor cell. So this will cause malignant proliferation or increased proliferation of blast cells. So when there is an increased proliferation of blast cell, it will come out of the bone marrow and circulate through the blood. So that is why the blast cells are seen in peripheral blood smear in acute leukemia. Coming to the third question, explain the steps of leukopoiesis. So all the blood cells are produced from hematopoietic stem cells. So from the hematopoietic stem cells, myeloid stem cell and lymphoid stem cells will be produced. So from the lymphoid stem cells, lymphoblast or lymphocytes will be produced. So from the myeloid stem cells, there will be production of erythrocytes, myeloblast and platelets. So now from the myeloblast, it forms the promyelocyte and later it forms a myelocyte, then it forms the metamyelocytes and then it forms the band cells to form the mature granulocytes. So granulocytes are basophil, neutrophil and eosinophil. And also it helps in the formation of monocyte. Okay. Now in addition there will be production of platelets. So this is how the WBC will be formed. So this forms a complete diagrammatic representation of leukopoiesis along with the flow chart. The last question, why does thrombocytopenia occur in this condition? So here in this case, I told you the bone marrow is actually filled with the blast cells. So the blast cells proliferation is very high that it will be compressing the other normal hemopoietic cells. So this will cause the reduced production of platelets by the megakaryocytes, and that will lead to a condition called thrombocytopenia. So that is the reason why thrombocytopenia occur in this case. Thank you.